Good morning, everyone. Welcome to the Columbus Chamber of Commerce's A Better Us webinar series. My name is Nick Sheriff. I serve as the Director of Development for the Columbus Chamber of Commerce, and I'm standing in this morning for Kelly Fuller, our Senior Vice President of Workforce and Workplace Innovation. Our A Better Us program supports whole person wellness for a stronger workforce because we know that wellness is not a perk, it is a business imperative. With rising healthcare costs and increasing demands on employees' time and energy, supporting whole person wellness is essential for sustainable, productive workplaces. Today, we'll be exploring the topic of care after a workplace crisis to learn practical strategies for providing emotional support, restoring stability, and fostering resilience among employees. To that end, it is my pleasure to introduce Dr. Delaney Smith, System Chief Clinical Officer for the Alcohol, Drug, and Mental Health Board of Franklin County. Dr. Smith first joined the ADAM-H board in August 2013. She brings an extensive background in the diagnosis and treatment of mental illness and substance use disorders. She has also held several leadership positions in the field of mental health and currently serves as an auxiliary assistant professor of psychiatry at The Ohio State University Medical Center, Department of Psychiatry, as well as Ohio University's College of Osteopathic Medicine in the Department of Specialty. Dr. Smith is joined this morning by colleagues Carolina Trindad, Senior Director of Human Resources at ADAM-H, and Heather Stumpf, Director of Community-Based Services at NetCare Access. Please join me in welcoming Dr. Smith and her colleagues, and I will turn it over to you. Thank you again.
Thank you so much. I just want to thank the Columbus Chamber for having us. We really appreciate the opportunity. Any chance we can reach out about the importance of mental health and supporting one another, our employees, our communities, really appreciated. So thank you. I'm going to attempt to share some slides here. And if someone could let me know, can you see the slides?
Yep, we see him.
Okay, wonderful. Let me make sure I can advance them. Okay. All right. So, I wanted today to talk about the importance of not only supporting our employees through kind of their everyday work life, but also, a lot of times today we see that there are different crises going on, whether it's personal crises someone might be experiencing, crises within an organization, community crises. It's really important, both from just the human aspect of caring for one another, as well as having a safe workplace and, getting the best we can out of our employees, that we keep this in mind. And, because today does offer so many opportunities, unfortunately, for crises to happen, it's really important that we're looking at this ahead of time so that we're not just being reactive after something happens, but that we're really thinking about how might we handle this situation if unfortunately it does arise. So, while we are talking about after a crisis today, I really would be remiss if I didn't start with how do you lay the groundwork before a crisis? Because so much of what we're going to talk about revolves around having a healthy relationship with your employees and with your coworkers, because you need people to trust you if they're in crisis. And trust doesn't happen overnight. Trust doesn't happen in a crisis. Trust is something that's built over time. So that's why it's really important that, we are emphasizing with our employees and our coworkers and just really anyone in our lives how important it is that we're taking care of our mental health on a day-to-day basis, because that's what's going to give us that ability and bandwidth to then respond when something does come up that we need to quickly deal with. So, I know at the board, Carolina and her colleagues do a great job with our employees of working a lot with them on different stress management techniques, working with employees on ways to take time out of their busy day, how to make sure they're engaging in self care and wellness. and really emphasizing that as part of the culture in the organization. And that's really important to sort of have that as the groundwork, that people have those skills, because just like any skill, whether it's, athletic, or, you're learning to knit, the more you practice that, the more it's going to be there, the more it's going to become muscle memory and natural for you. And that's the exact same thing that we see when it comes to dealing with stress and dealing with crisis and being prepared. And the other kind of pre-care thing that's really important is that people who are in an organization understand what resources are available to them. And Caroline will touch a little bit more on that. But what kinds of things does the organization offer in terms of wellness programming, from the medical standpoint, from EAPs, things like that? How do we emphasize people taking care of their health again, so that they're ready to deal with the unfortunate event where a crisis might occur? And then I think, like I said, the biggest thing is having that trust, because if someone doesn't feel like they can trust you, they're not going to come to you when things start to get bad. And then things, unfortunately, will progress to the point where it's more and more difficult to help them if they don't come to you early on. So, really taking any opportunity to build that trust, to build that rapport early on with coworkers and employees, so that they know that you're someone they can turn to, that this is a safe space, that they have that support when they do need it, is really important. And something I often talk about is, not assuming that you start from a position of trust, because people bring their own experiences, whether it's their personal experience, or maybe they've had negative work experiences before and felt that they couldn't trust coworkers or management. So not just assuming that that trust exists, but really working to show that you're someone who is trustworthy, and working to build that relationship, because you just don't know. I think we all assume and hope that we're going to start from sort of this position of trust. And as long as we don't do something to like degrade it, we're okay. But really, we do have to remember that different people come from different backgrounds. And so you may really have to kind of bridge that gap and show them and build that trust, and work from the background that, maybe this person hasn't had positive experiences before. You need to show them that this is different. So again, this comes back to the idea of the work environment feeling positive, feeling like people are appreciated and respected, showing that contributions are recognized, supporting that work-life balance, because, while work can do so much to support, really people also need to have that base at home and outside of work, and need to feel like that's honored as well. Because if there is a crisis, work is going to be there. They're going to support. It's wonderful that people are here learning about this, but we also need to make sure that we're fostering people having those healthy, outside of work supports. And part of that is, making sure people have a healthy work-life balance, and that it's clear from an organizational perspective that that's something that is emphasized for them. And that everyone feels welcome, that their own culture and background feels appreciated, so that they do feel safe to share. Having an ability to communicate is going to be vital if there is a crisis. So, a lot of this is going to revolve around someone opening up, feeling like they can share those emotions, and a lot of that is going to be early work that you do with your employees or your coworkers, showing them that you're hearing what they're saying, you're processing what they're saying, and it's being reflected back to them. And we think communication is something that, we're all innately aware of how to do. But, again, we come from different backgrounds. We have different communication styles. So the more you get to know people within your organization on an individual level, and understand the way your messaging is being received by them, the better it is for having those open lines of communication, and people to feel like they can share with you. So encouraging employees to voice concerns, suggestions, showing how that's heard and what action steps are being taken. Ensuring that leaders within the organization at various levels are approachable and responsive. Those are all things that can really help build that framework in an organization, so that people feel like they can be supported within work if a crisis arrives. Okay, so that's kind of what we can do on the early end to sort of set a positive framework, build an organization that is going to support our employees. But then if we look at the period of a crisis, it's going to really build on that. It's going to rely on the work that you've done on the front end because a lot of, what's going to have to happen during a crisis is going to be communication. So again, crises can come in many different forms. Unfortunately, there have been organizations that have had pretty substantial crises happen during the workday, on site. It could be something that happens outside of the workday. But either way, communicating with staff is going to be the key. People don't like to feel like they're being kept in the dark. And if you don't give them information is going to be kind of made up. So if it's not coming from the top, from leadership down, it's going to come from coworker level, and people are going to be speculating, people are going to be creating scenarios, and there's just going to be more stress and uncertainty if people aren't getting the information that they need in a clear way from the top down. So it's really important that even if you don't know, it might be a situation that's still evolving at the time where you don't know all of the details, but just having that communication, we are looking into it, we are figuring out what's going on, and keeping that line of communication open. Because, like I said, communication is a void. And if you're not the one filling it, someone is going to be filling it. And it's most likely going to be with misinformation and with things that are going to just make that stress and that crisis response more chaotic for people. So information being timely, information being accurate to the best of the ability that you have, which again, it might be very, very limited, but just being upfront, providing what you can and expressing what the limits are that you have. And then multiple channels of communication. Again, at the board, I know our staff, they do a great job of checking the communication, sending out messages to make sure that people are able to receive it. So if that's not something your organization does, double checking that you have the capacity to send out text messages to the organization so that you know ahead of time, yes, these are getting received. This is a way to send information, and using those multiple channels, sending email and text messages, having a meeting so that people have the opportunity to be there. If questions can be addressed, giving people the opportunity to ask some questions. All of those things are really helpful. And then again, because of that kind of vacuum effect, the more you can designate specific spokespersons, the better. Because then if, your second tier line of management might not know, everyone might not be on the same page of what's going on yet. But if you can designate, this is the one person that, leadership is going to make our spokesperson, they're always going to be aware. Please direct your questions to them, and make sure it's someone that staff feel like they can trust, that have developed that relationship and rapport with staff like we talked about before. Um, as early as possible, working with staff to ensure that there are those safety measures being taken is going to be important in addition to communication. And again, so much of this does require groundwork. So, having safety protocols, having individuals who are designated on different floors to be sort of a captain. And I know I keep referencing the board, but the more I was thinking about this to prepare for this, the more I recognize what an amazing job the board does, where there are people designated on each floor. This is sort of your safety captain, so that if something happens in the workplace, people know who to turn to. They know that someone's looking out for them, someone's making sure that they exit the building, doing drills. Again, this might be something that happens within the actual facility that's a safety issue. And we need that muscle memory. We need to practice it, because if we don't practice it when things are calm, we're not going to be able to do it accurately when things are not calm. So practicing evacuating, practicing what do you do if it's a threat within the building, if it's a situation that needs to be sheltered in place, really having those plans worked out in advance so that what you're going to do and what you expect of your employees. And then when you're practicing them in low stakes times, those kinks can get ironed out because you may recognize that, what you thought was the perfect plan actually doesn't work, or you didn't think about, a staff member you have who taking the stairs might be a barrier for, and what do you do if this is a situation where the elevator is out, things like that. Um, Again, if this is the moment of crisis going on, you're going to want to implement those processes that you already have in place. Reassure people, this is what we've been practicing for. We know what we're doing, demonstrating that calm leadership style. And then telling them, we are here for you. We're here to provide both for your medical and your physical safety to get you out of the building, but we're also here for you. And, I think Heather's going to talk a little bit about some on-site opportunities that, NetCare helps with in times of crisis. So I'll let her speak more to that. But, there are things that you can do, resources that you can bring into the facility itself if you need it, if there is like a crisis of that level. Um, this might be more of a personal crisis. So again, it could be something that's agency wide, that's happening real time within the agency, or this might be a crisis that someone's going through on a more personal level, in which case, again, it's going to rely on that trust and that communication and anything you can do to show that you're supporting them, having flexible work arrangements if that's something that your organization is able to do, remote work options, flexible hours, reminding them of what the agency offers in terms of employee assistance programming or, time off, things like that. Keeping leave policies in a way that really does make the person feel supported and not punished if they need to take time off, and emphasizing that before the crisis happens so that they know, that these opportunities are there, they're real. We encourage people to take them so that they don't feel like, oh, this is just kind of lip service that people are giving. Um, And, if this is something that impacts the broader community, that the community as a whole is going through, it's not just on a personal level, it's not just on an organizational level, it's a community crisis that sort of offers different opportunities that an employer can look at as a way to support. So, in those kinds of ways, it's just really showing that the organization, the agency is a part of the community. It's a function of the community. It's there to support the community. It's made up of members of the community and wanting to serve the community. And that's where employers can really play a very supportive role. And sometimes thinking outside of the box can, really show your employees how much the agency values both them and the community. So things like donation matching, volunteer opportunities, even on a day-to-day basis, there's a lot of opportunities for organizations to, volunteer as a group of employees, serving meals at shelters, things like that. But, these are times when the agency can come together and create some new volunteer opportunities, raise awareness, promote community support initiatives. So, really recognizing on a larger scale how to respond to the community, but not losing sight of how, whatever that is impacting the individual employees and supporting them as well. And then, again, we sort of think of this as a timeline. So pre-crisis, during crisis, post-crisis. So the period immediately following a crisis is really important. So it's going to continue that theme of communication. So, some of this is going to be debriefing, making sure that your staff are heard about, what did we do right? What opportunities are there to respond differently in the future? So that employees feel like we're a part of this. We all were taken off guard. No matter how much you prepare for a crisis, you're going to feel taken off guard. It's not going to be the exact scenario you prepared for, but, really celebrating what went well, what were the successes, but what opportunities are there to make sure next time we're prepared for the different scenario that we just didn't even think about. So you just want them to be heard, be a part of that process. Again, emphasizing mental health resources that are available to your employees, and really normalizing the fact that everyone is going to have an emotional response. If there's a crisis that impacts a community, impacts one of your coworkers, impacts the agency, we're all going to have a response because, again, we all bring our own background experiences. It might remind us of something else that happened to us before. It might make us question our safety, even if it didn't directly impact us, or bring up anxieties about the safety of our family or things like that. So just normalizing, any range of emotions is appropriate. Some people feel numb after crises. All of those things are feelings, they're all valid, and just giving people that validity and that space so that they feel like they can continue to be open and honest and share their feelings is important. Um, and then, continuing to offer that access to mental health support, whether it's through EAPs, whether it's, something the agency wants to bring in, just continuing that even as the crisis gets further out, because sometimes, we do a great job in the moment of crisis, we do a great job, a week or two after, but for some people, they're still in fight or flight mode a week or two after. They're not really processing those feelings yet. They're in survival mode. And it's not until sort of that initial, adrenaline rush kind of calms down, which for some people could be a few weeks, could be even longer, when they start to find, wait a minute, I'm waking up at night. I'm not sleeping like I used to. Suddenly I'm having nightmares, but they're not even about what happened, and they might not even be putting it together. So continuing to sort of check in with employees, how are they doing long term, offering that support, and then continuing those training and development opportunities. So, continuing to express to the staff, we're going to keep playing through these scenarios. We're going to keep making sure that we've got, these processes in place that we all feel comfortable with. We're going to do different lunch and learns about mental health, about coping strategies, bringing in people to talk about these things, all of that. So it continues to support your employees and they don't feel like, oh, the meal train's done, the immediate support is over. I'm sort of left now in the woods to figure out these feelings that I have. And then just, keeping the work going that you started with, being prepared for the next time. So keeping up with promoting that cohesion amongst employees, making sure people feel like not only can they rely on their immediate coworkers, but their levels of leadership and supervision, through team building, through social events, so people can get to know one another outside of that very structured hierarchical setting of work, and recognize that, their coworkers and leaders value them as people, and that also they value their coworkers as people, so that they're there for their coworkers when they need support. So that was kind of what I had on just kind of the walking through how things work in terms of how laying the groundwork supports people, how we can help them both during the crisis, after the crisis. Um, and then I was going to turn it over next to Heather, if that's okay, just to talk a little bit about what NetCare offers the community, because they have some really amazing services that I don't know that people are even aware of. And I'm going to go ahead and try to stop sharing here if I can figure out how to do that.
I think I can replace you here.
Okay, I was going to say.
Just a quick reminder to our audience while we switch over presenters. You guys are welcome to add questions into the chat of our meeting at any time. Once everyone is done presenting, we will have a few minutes to cover those. So that might be a great way to remember what you want to talk about later.
Okay, can everybody see that slide?
Yep, good to go.
Yes. So I'm only going to share maybe 2 slides, but I wanted to make sure that the phone number is up there. So again, my name's Heather Stumpf. I'm the Director of Community-Based Services at NetCare. I wanted to talk a little bit about services that could be helpful to businesses and organizations, and also some additional services if there's employees in crisis that could be helpful in supporting the workforce. I just wanted to build off what was stated about EAP. I think that's a great resource. I think the more it's normalized in an organization and it's talked about, people feel less stigmatized to access it. And I think organizations are always trying to figure out, can they expand it? What's the cost versus benefit? I know some mental health agencies have expanded that to be more than 3 sessions free. And just to give people a place that they can access those services. And also just a reminder about 988 too, just helpful for folks who may not come forward if there's, things going on, having that information posted around could be a benefit just to remind people. NetCare is one of the organizations. There's a North Central Mental Health is the main organization, but it is anonymous. People can call, they can chat, and they can reach someone to talk through, what they're going through. So I'm going to focus a little bit more on post-crisis. But I did just want to put that up there. The 276-CARE 276-2273 is the best number to reach us for all the things. All right. I'm actually going to X out of that. Okay. Our community-based services, I was having some issues with my slide for some reason, so bear with me just one moment. Okay, this is the last slide I wanted to share. Our community-based services, so our community mobile team provides a service called CCR. So there are a couple of functions. So in general, our community mobile team is a number that can be accessed through the 276-CARE. If somebody is, communicating with somebody on 988, often that's resolved on the phone. But if it does require an in-person response, we can go out to meet with somebody in a crisis. And that's a self-defined crisis. So however somebody, from their, if they're at home and they have a crisis, they can call us and we will go out versus going to an emergency department, et cetera. What we can do if there is a crisis in the community that requires an immediate response. So an example would be if, I'll give a community example than a workplace. If there is a completed suicide in the community, the police can call us and we can be on scene to help folks, help families on the scene, which is really more holding space for people. It's not really a time for counseling, giving some resources. Often in a crisis, people's brains aren't in the processing space where they can take a lot of information, so we give them physical stuff and follow up later. So that could also apply to a workplace. If there was some kind of incident where the police were involved, typically the police would call us, but we're happy to receive, a call if people on scene need something. And again, that's going to be kind of making ourselves available, whether, people want to access us or not, that's okay, we're there. Problem solving with people, how are people going to get home? Who are they going to be with tonight? That kind of stuff, just to provide some extra support on the scene. And we call that psychological first aid. So there's a lot that we can do there. Sometimes businesses have an incident where maybe, people find out that, just an example, maybe an employee had been in a very bad car accident and had passed away, or had attempted suicide and died by suicide. So people come to work and they, this awareness is brought to them. We can be called directly by an employer for that. We're happy to come out. What that looks like, we don't debrief. If people have ever participated in kind of the debriefing model in a more of a mental health sense, we don't put everybody in a room and debrief as what used to be done 10 years ago. But we can come and be on site and be available for people to come access us as they want to or as they don't want to. And sometimes nobody accesses us, and that's totally fine. We're there if someone wants to talk to somebody, if they want resources, if they want education, if they want to know how to help. But a lot of times it's the employer showing that they care enough. I'm going to stop sharing here. That they care enough about what's going on that they brought in somebody. And sometimes the act of the employer bringing somebody in speaks volumes to employees that they care about how people are doing. In addition to the EAP, I just wanted to let folks know that we do also at NetCare have outpatient counseling and psychiatry. We're here in the Franklinton area. So if there's an employee who maybe after an accident or a tragedy needs some ongoing care, and for whatever reason the EAP is maybe too short or they don't have the resources to extend it beyond the free sessions, folks can come to us for counseling. They don't have to have insurance. They can have insurance. They don't have to be documented. We really don't turn people away. So we have two options. They can come and get an assessment and we can help them find the right services out there in the community, or they could continue with us if they wanted to. So if there's ever an employee who's struggling financially, and it's not only us, there's, other agencies like North Central, Southeast, Concord, North Community, places where someone struggling financially, that shouldn't be a barrier to them accessing ongoing services. So that is it in a nutshell. I am happy to answer any questions now, or if it makes the most sense to pass off and we can address questions at the end, that's fine as well.
Yeah, maybe if we pass off to Carolina, because I think she'll kind of close the gap from the HR perspective, and then we can all take any questions at the end.
Sure thing. Good morning, everyone. It is so wonderful to be with you this morning. Thank you to the Columbus Chamber for the invitation. I'm going to share my slide here. I have one slide to share with you all. Let me know if you see it, okay?
All set.
All right, wonderful. And so as Heather focused on post-crisis, I am going to go back to that front end work that Dr. Smith first talked to us about. And you all know as leaders, an effective response really begins before that crisis occurs. It's going to start with how you plan, lead, and strengthen your organization today. And so I'm going to talk more about specifically what that looks like at AdamH. And we really believe resilience is that foundation to effective workplace crisis response, and organizational resilience isn't built in that moment of crisis. It's built every day through intentional practices. So what that looks like for us, you heard Dr. Smith talk about that, building a culture of trust. When employees believe their voices matter, when they are seeing that they influence the space, they're more likely to stay engaged and support one another during challenges. What that looks like for us, a couple examples is we do complete an annual employee engagement survey. I think for the last 3 years, we have hovered around an 80% response rate on that employee engagement survey. We engaged in follow-up listening sessions to share results of those surveys, and we also create action steps together with our team. We also have various different committees that our staff can be a part of. An example is we have a togetherness, a training, and a safety committee. Our safety committee just completed a project, for example, where they put together new safety kits for all of our floors. And so that is an opportunity for them to contribute, to build relationships within those members, within the committee, and also strengthen engagement and improve our processes overall. So now we have these brand new safety kits, flashlights, we have blankets, we have first aid kits, we have our weather radios. Not only do we have those kits together, but we also now have a process on how to maintain them, and identified a role who will be in charge of maintaining those kits. Second piece of this, so important, is how we prepare our leaders. You heard Dr. Smith talk about this as well. Leaders, as you know, they set this tone for organizational resilience in any type of disruption. So calm, clear communication and thoughtful decision-making really create stability and model how we should respond effectively in crisis. What that has looked for us at AdamH is we have engaged in, for example, psychological safety training to help our leaders foster open and inclusive and supportive environments. And yes, these types of trainings, when we do put them out, they are not optional trainings. They are required trainings that we have for our leadership. This preparation of leaders also looks like engaging in tabletop exercises. So this is an environment where we've had various opportunities to engage in disruption scenarios. I know many of you have been discussing what is going on with funding in the environment. You know, specifically to us, it was around Medicaid funding. So we engaged in tabletop exercises where we walk through what would disruptions look like? How can we strengthen our crisis response across the board within our organization? And also what that looked like within our provider network as well. When we talk about strengthening workforce capacity, so resilience really grows when employees are both equipped with both practical skills and also they have meaningful support. So building that capacity ensures that essential work, of course, continues. And we want to make sure with that support that staff feels prepared to handle challenges. Examples for our organization has been we are intentional in cross-training to maintain continuity during absences or disruptions. We also launched a new Lunch and Learn series that covers topics from grief recovery as well as financial wellness. This is a way for our staff to also get to know more about what our Employee Wellness Solutions program offers, which is our version of an EAP program. So we have trainers come in that are connected to that employee wellness program. They get to know who the counselors are that are available through that program. And this is an optional learning series that provides not just workforce related training, but also, like I said, those financial wellness trainings on top of more workforce related trainings. We complemented this new series with a dedicated staff wellness room where our staff can engage in mindfulness activities. They can take a break and do some stress relief, meditation, whatever feels right to them, and have a dedicated space that they can use for that. When it comes to more formal training initiatives, we have engaged in mental health first aid, as well as QPR training, which is question, persuade, refer. This is a suicide prevention training. This certification provides our staff with tools for themselves and also tools that help them support each other. With the next step with the reinforcing systems and processes, policies and protocols only build resilience if they are reliable, they're shared, they're practiced, they're tested. I know Dr. Smith talked about that communication program that we have. We utilize Everbridge. This is where you're going to get your emergency communication, or whether, you know, if it's a crisis, community crisis, or even a weather event. Now that is only going to work for us if we make sure that individuals are getting that communication. So Dr. Smith talked about the testing that we do with that. We make sure that our employees are receiving that communication through quarterly testing of that system. We are also reviewing our continuity of operations plan to ensure our roles, steps, and checklists are clearly defined. They're documented, they're accessible to staff. And this is, I believe, the second in-depth review that we've done of our plan in the last 4 years. So we have a specific role identified that is the holder of the community continuity of operations plan. We have a backup for that. It's something we're continuously looking at, but we do have more in-depth reviews on a biannual or in every 2 years is our frequency for that. One of the things that I've really enjoyed that we have instilled and included as part of whether it's a cross-functional project, whether it's a drill that we do as an organization, is an after action debrief. And this is an opportunity to highlight our lessons learned. It's an opportunity to also celebrate stories of adaptability and resilience. And this is something our staff has really taken to, and I have seen it being implemented in various different ways. It's an opportunity to include discussion in a more informal way. And it's been really great to see how our workforce has taken that on and included it in part of closing out various different actions and projects that we have done together. Last and certainly not least, and you've heard Heather talk about what community and partnerships opportunities are there. I love this Better Us series because this is a part of this expanding community and external partnerships. Absolutely no organization is resilient alone. And so leveraging community expertise and strengthening networks builds collective recovery, which is so important. An example for us at AdamH is one of the first things we did when I started at AdamH was create a dedicated, and this is a vision of our CEO, Erica Clark-Jones, a dedicated advocacy and engagement team department. And this really helped us to deepen partnerships and amplify community connections. With that, we have been able to really leverage our role as a convener to align partners and advance the resilience of our whole behavioral health system, including, I'm sure you all have heard of, hopefully you were able to visit and do a tour of our Franklin County Crisis Care Center that opened up in September. You know, this is a collaborative community resource, and it is such an amazing example of what happens when we come together to meet the needs of some of our most vulnerable in our community. So I just wanted to provide specific examples of what that pre-work looks like. We continue to try to implement that resilience first approach at AdamH to strengthen our workplace crisis response. And this work is something that it's about continuous improvement. You're never really done with it. You're never really completed with it, right? And the way that we have framed this for us is really intended to support a workforce now and prepare us to meet future challenges with confidence in the future. Thank you so much.
So thank you all for coming. I just wanted to piggyback and combine something that sort of Heather mentioned and Carolina said. You know, people may not take advantage of these things the first time or the second time or the fifth time, but the more they know that these resources are there for them, the more they feel supported. You know, like another thing that the AdamH board does that I haven't gotten to take advantage of yet, but I would love to, but just knowing that it's there is really encouraging to me, is they do a walking group. It isn't specifically about mental health. It's not specifically about crisis. It's just about a time that's, you know, we're going to be together outside of meetings. You know, we're going to foster this relationship and rapport that we have with each other while also making sure that people are taking care of themselves. And maybe you don't get everyone to take advantage of it the first time, but, you know, people know that they're valued on an individual level. And I think that's so important. So we're happy to take any questions you all might have.
Yeah, so everyone with us this morning, we do have a couple minutes for questions. Please pose those by typing them into the chat, and we'll kind of route them from there. While everyone thinks for a moment and starts typing in your questions, I do have one for the panel. We talked a lot about EAPs today, both preparing them beforehand, using them during and after a crisis. I'm curious, for any company that doesn't already have an EAP as part of their benefits plan, do you guys have any advice on how to find a provider for that?
Carolina, can you handle that one? I don't have any advice on that.
One of the things that I would say is, from my lens and in this public sector space, the Franklin County Human Resources Department is a great resource to find providers. You know, they go through a RFP proposal process. They talk to various providers, and they definitely have information that can be useful for companies that are looking for vendors to engage with. So I think that would be definitely a great resource to connect with, is the Franklin County Cooperative, and I'm also happy to provide contact information to anybody who's interested. You heard me talk about, speaking of EAP, and certain trainings that we provide to staff. If you want to bring in mental health first aid, if you want to bring in QPR, that suicide prevention training, please reach out to me. I'll get you connected with a trainer as well for that. And so I'm happy to provide contact information and connect you to somebody who can get you either a trainer or information on available vendors for EAP support.
Fantastic. Thank you for serving as that resource, Carolina. And I think our next question is also directed your way. So thinking about the safety committee example that you shared, how did you determine what to include in those crisis kits?
Yes, this was a great project because many of us, this was not our expertise, right? This committee brings people from all teams. And so you're not necessarily as part of our building management team. You could be a part of a fiscal team and you are in a safety committee because you're interested and you want to build a culture of safety. And so what we did is we reached out to our public safety team with the county. We essentially in the public space, we have our own OSHA, right? And so we reached out to them and their expertise on what we needed to make sure we had in those kits. We did our own research as well on what we could find within the PERP website for us. So found really great content on there. And then we did lean on, for example, our building director's expertise on some of the things we want to make sure we had in those kits. And so all of that information on what we wanted to have came from those risk management supports and resources. And then some of the things that might have not necessarily been on those risk management resources came from the discussions that we had within the committee. So we wanted to make sure we had a way to charge different equipment. That is not something that was on the risk management list necessarily, but it was something we came up with because of the discussions we were having with individuals who came from different backgrounds in our organization, right? Do we have something that we can use that doesn't need to be plugged in, that has different charging types, cords, so that we can charge different devices? So expertise from OSHA, or if you're a public employer, that PERP website, and you'll also find that things come up as you're talking with different individuals in the committee that might have not been necessarily on that official list.
Fantastic. Thank you again. And I will add one to that. When I used to work for recreation centers, we followed a lot of Red Cross publications around what kinds of materials and equipment to keep around and how much of it to keep around. So if you don't find what you're looking for from what Carolina shared, that might be another resource as well.
The Franklin County Emergency Management Agency has a really great resource with creating kits as well. I know they put out information during severe weather week. So that is a great call out, Nick, and I would add the Emergency Management Agency as well, Franklin County.
Very cool. We do have another question. Can you share contact info to reach out for any of these free resources, specifically referencing training opportunities? I think that's something that we as the chamber will kind of work with our speakers to gather anyone that stands out, and we can share that in a follow-up email. Might be a little bit more efficient that way. Are there any other questions from the group today? I'll pause for a moment so you can send them in. All right. Well, thank you again, Dr. Smith, Carolina, Heather. You guys have had some amazing information for us today, both before, during, and after a crisis to help us get ready to support our teams. Audience, we hope that you guys will join us for another Columbus Chamber program soon, including our upcoming webinars in the A Better Us series. Information about all of the events that we run can be found online at columbus.org/events. Thank you again for logging in this morning, and I hope you have a wonderful rest of your day. Bye, everyone.